My name is Karina Ohri, and I'm a third-year medical student at SUNY Upstate Medical University in Syracuse, New York. We examined post-pandemic masking practices among healthcare personnel at SUNY Upstate Medical University, and we looked at the beliefs, barriers, and perceptions for improving masking in clinical settings. So we know that healthcare workers face a significant risk of healthcare-associated respiratory infection, and facial masking has been shown to reduce the risk of these infections. However, post-pandemic, many healthcare centers have withdrawn their universal masking policies, leaving the decision up to either individual masking behavior or depending on contact or respiratory precautions. And so we wanted to ultimately understand what are the mask-related barriers, behaviors, and perceptions among healthcare personnel, and ultimately assess the influence of both COVID-19 and influenza vaccination status on masking behaviors. And we want to enhance adherence to universal masking by implementing evidence-based interventions. So we did this by doing a cross-sectional semi-quantitative survey that we administered through REDCap, and we only surveyed upstate staff who had direct patient care duties. And the survey was conducted from November of 2024 to January of 2025, and we had a total of 23 questions, and we did analyze the data by stratified analysis, by vaccination status, and by role. We had a total of 655 respondents, most of whom were white, female, and had a mean age of around 44 years. We had a wide range of hospital roles, including medical doctors, nurse practitioners, registered nurses, master-level clinicians, and those from ancillary services. And we found that overall, 51.1% of our respondents were up to date on their COVID-19 vaccination, and 76.5% intended to receive the 2024 to 2025 influenza vaccine. And we also wanted to look at the relationship between participant roles and masking behavior across different clinical settings. So we had a total of 5 clinical settings in which we asked participants if they would mask in each of those settings. And interestingly, we found that high adherence, which we defined as above 75 percentile based on literature review, was only seen in 2 clinical settings, when participants were entering a room on droplet precautions, or when they were sick or showing respiratory symptoms. And in all other clinical behaviors, the masking adherence was very low. And there was one situation when collecting a respiratory specimen when participants were more likely to say no to masking in that scenario. And in terms of roles, we found that registered nurses had the highest adherence, so above 75 percentile, when entering a room on droplet precautions. And we also analyzed the influence of vaccination status, both COVID-19 vaccination status and influenza vaccine. And we found that among those who were up to date on their COVID-19 vaccination status, 82.4% said they would wear a mask when they were sick, whereas only 40.6% said they would wear a mask when collecting a respiratory specimen. And this was seen very similarly in the influenza vaccine, where we had asked participants, if you intended to receive the influenza vaccine, what percentage of those respondents actually masked. And 81.2% said they would wear a mask when they were sick, and 39.1% said they would wear a mask when collecting a respiratory specimen. So the results of those two are very similar, overall showing that masking adherence is relatively low in all other clinical situations, except when participants were sick. So ultimately, in conclusion, masking adherence remains very low, indicating an urgent need for improvement as we approach respiratory season. And vaccinated participants' adherence to masking was low across all clinical situations, except when they were showing respiratory symptoms, suggesting a reduced perceived vulnerability to infection. And ultimately, we want to overcome these barriers, and further research is needed to overcome these barriers to consistent masking.
Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.